when the pandemic hit, appropriately, we wanted to limit the population from travel, visiting various buildings, interacting with other people as much as possible. One of the negative aspects of that was that people stopped getting their routine health care, and that has serious consequences.
Hi, just going to take your temperature, Tara.
Sure.
96.5, we're going to use Purell.
Thank you.
And then Gina's going to take your
You have a ride home today?
Yes, I do.
Major effort was made to make the process safe, but to continue with the routine health care.
All right. All you'll have to do is click on there, and you'll actually have to get your license out
Oh, sure.
if you have that.
I do.
And you're all set. So now you can go over to that desk and get checked in for your
Fantastic.
procedure.
Thank you.
We take precautions like everybody's potentially an infectious risk. And even before the patient is invited to our endoscopy suite, they are tested for COVID as an outpatient. We'll try to keep people safe and healthy otherwise while we get through this pandemic. I think most patients will find this to be a calmer atmosphere, not walking into a major hospital. They will find that the one-on-one attention and care and recognition of who you are and what you're here for is a very calming influence.
All right, I'll let you get changed. I'm just gonna log on the computer here and we'll go over your past medical history. If that's
Okay.
okay.
Sure.
Hello, hi, I'm Dr. Bailon, anesthesia. How are you today?
Good. How are
I'm
you?
going to do your anesthesia assessments.
How was your prep yesterday? Good?
It was okay. Yeah.
All right, well, you met Marie. The objective of the colonoscopy, in addition to detecting cancer if you have it, is to remove these benign lesions before they progress. So that's why I say this is the only test that actually prevents a cancer in your body. It's a life-saving procedure, and anything you have heard, we have 1,000 more stories that everything has gone well. The preparation is very important. Her prep is very good, because if the prep is not good, then you may not see all the surface area, and you may miss some polyps. The whole procedure is fairly seamless. There's a routine that people follow. Only when you follow the same routine, you don't make mistakes, you don't cut corners. Ileum, or the small intestine, we know we have seen the whole colon and didn't miss anything. We have seen this time and time again when there is awareness and people go to get tested. We have shown clearly that 2 to 3 years down the road, the incidence of colorectal cancer in the United States drops. Recently, Chadwick Boseman, Black Panther fame, unfortunately died of colorectal cancer. And what people don't realize, he's a young guy, but colon cancer is moving towards the younger spectrum. And the whole point is to identify polyps and remove them so that they don't go into cancer. If you are in the normal, healthy population with no family history of colon polyps or colon cancer, then the age to start screening was at age 50 up until a few years ago when the American Cancer Society said we should start at 45. So there are things changing in regards to when we might even move the 45 even earlier, because it is the environment it is the processed foods, it is our way of life that we just cannot escape. And we think that is how the epidemiology of colon cancer is changing, not just in this country, but all westernized nations. So with our success, we have grown quite a bit, and we do over 9,000 procedures in this facility. We endeavor to be the most comprehensive gastroenterology care facility in the area, if not the state. Be safe, be careful. Do not allow routine screenings, routine health care to go by the wayside, because you may escape the pandemic, but now you notice that you have something else that could have been prevented.